There we go. So once we've finished the webinar, the recording will become available on our YouTube channel, and you should also receive an email with a copy of the recording also. So I will hand over both of these lovely ladies.
Thanks, thank you. Okay, so I'm Judith, this is Katie. We both were formerly head teachers in two outstanding special schools. So we've worked together in schools a long time, and recently Katie's come to join me at Education and Case Management Services. We're both practitioners, and therefore we have the privilege of going into lots of schools, giving advice about the practical needs of children, looking at their Ehcps, maybe looking sometimes at things like mediation, and we pride ourselves on trying to avoid tribunal. So what we were asked to do today was talk about Ehcps, and we were given some key questions to think about. So we're going to talk you through some theory about Ehcps and what the law tells us, but then also chat about what's practical and what's reasonable in schools. We need to just start by saying that we work with colleague Rachel Smurthwaite at Irwin Mitchell Solicitors, and we recently did a seminar for families with her. So some of the legal slides and legal information we pinched from her, and we wanted to acknowledge that it's not all just our own, but that's about the facts. And so what we'd like to do is share the facts about Ehcps, what does the law tell us, but then also to give colleagues some tips on how we can make those work for us as practitioners in the field. Okay, so some of the basics, and some of this you might know, so we won't spend ages going through this, but it's helpful to know. So in terms of an Ehcp, an Education, Health and Care Plan, it's a legal document, and that's really important to know that. So it then means that the local authority have a legal duty to deliver the provision that's detailed within it. It's about special educational needs. It can also include though health and social care needs, and that's really important that it's an integrated one document. Children can have an Ehcp up to the age of 25. However, we would say that most Ehcps would cease around the age of 22, 23 at the latest, unless there's a very good reason for it to continue. And the benefits of having an Ehcp, well, it means that there's been a formal assessment of need. It's a very holistic document, so everything is brought together, the education, the health and the social care. It is enforceable. So if there's a problem with not getting what a child needs, the Ehcp is a legal document, which means we can do something about it. It can mean, therefore, that you get some funding towards that, and that might be therapy or additional teaching assistance support. And it does give children access to special schools. So without an Ehcp, you cannot go to a special school. Before you get an Ehcp, sometimes a child will have additional funding. So that funding might be made available, and it could be categorised as high needs funding. Sometimes that name differs in different local authorities. So sometimes a school can get access to some money more quickly than going through the whole Ehcp process. And we'll talk to you about timescales in a moment. High needs funding means that a school will apply for some high needs funding, and they'll have to do that each year to demonstrate that needs haven't changed. The local authority, though, can withdraw high needs funding, so that's not a legally binding document. And you don't just have to say exactly what the funding is for, and you don't always have to prove it. So a parent might think the funding is for one-to-one, but actually the school are using it for interventions. So parents don't have any control over high needs funding. So why is an Ehcp important? Well, basically it will set out what is available from the local authority. What is the support that they're going to provide for the child or the young person? The child has a legal entitlement to the provision that's detailed in section F, and we're going to talk you through those sections of the Ehcp. It means there's had to be a proper assessment of needs. You can't just draft an Ehcp. It's supported by lots of other documents and reports from professionals. It does mean you can get additional support. It means there's access to a special school if that's what's required. And that can also be an independent or a non-maintained special school. It can go up to the age of 25, but as we said before, mostly never beyond the age of 22, 23. That would be very rare. but a lot of local authorities will look hard at the Ehcp from the age of 18 to see if the child continues to need that document. So there's no guarantee that the plan will go on from year to year. It has to be reviewed on an annual basis.
So when can an EHC assessment be requested? We get this information, this request a lot for people to try and understand when a child can have an EHC and when one should be issued. She's got a mark, it confuses me. So there's two ways that you can get an EHC. One, it can come through a parental assessment, and one, it can come through an assessment through the school. What I've got on there is just a statutory timescale about an EHC needs assessment. So what we talk about is we talk about pressing the button. So we talk about the very first box is about pressing the button when you press the button to request an assessment. From there, the entire process should legally take 20 weeks. So you have different timescales where the local authority decide whether to conduct an assessment, first of all, a period of time where the assessment is completed, a period of time where they complete the assessments, then they draft the plan, then a final plan is issued. Various things happen at each stage. So after the first request for a plan, it can be turned down at this stage. That can be appealed. Then they can complete an assessment. It can be turned down at that stage. That can be appealed. Then they produce a draft where we get 15 days to decide if we all agree on the draft. Then that can be appealed. Then the final plan is issued and that can be appealed. So there's lots of different processes within that. Parental assessments tend to be less successful than school assessments, because quite often the local authority likes to see that we have done an assess, plan, do and review. There's various myths in schools that you have to have 2 cycles of assess, plan, do, review. Well, for us, a lot of the children may have a road traffic accident and may very clearly need an EHCP for them going back to school. It's really difficult to do 2 cycles of assess, plan, do, review in that process. However, Code of Practice does like to say that they like to say that schools have done it. There's lots of myths around money about how much has to be spent, and there's a mythical £4,000, there's a mythical £6,000, and that's in relation to the element funding that Judith just talked about. So there's 3 elements of funding. There's element 1 funding, which is standard funding that every child in every school gets, which is normally £4,000 per pupil. There's a next element of funding, which is what comes from the school's notional SEN budget, which is element 2 funding. That is normally around £6,000 per child. So what they like to see is that you can't meet their needs through the notional funding. So the £4,000 per every pupil, the £6,000 for every SEN pupil makes you £10,000. We have to prove that that £10,000 is not sufficient to meet the needs of the child, therefore they need an EHCP to bring more money in. Just press the button. So, as I said, it can be requested by parent, young person themselves. That's not, well, we have got one young person who would have requested it himself, but normally it's by the parent or by the school on behalf of them. We have some at the moment where we have requested it as a parent and then they've asked the school straight afterwards to put in a school request. Anyone can bring the child to the attention of the local authority. It can be a GP, it can be a therapist, anyone is able to do that. And legally, there is the legal test for an EHC assessment, not an EHC plan, an EHC assessment, that the child or young person has SEN and it may be necessary for SEN provision to be made in accordance with an EHCP. There's no duty to assess just because a child has a disability. The local authority like to develop their own criteria and guidelines. Obviously, we work nationally, so we have lots of experience with different local authorities. When we were heads, I dealt with 21 different local authorities, and they like to say how they do it in that local authority, and we like to refer them back to the Code of Practice. So they do like to develop their own criteria, but it's helpful to remind them of what the law is in relation to this. Case law to say it's not sufficient for the local authority to say that support is theoretically available if in reality the child is not receiving it. So the child has to be actually getting the support rather than we do offer it, which is obviously slightly different. So, oh, sorry, our things over our information. So an EHCP can't happen without the parent or the young person. They really need to be informed that this is happening. what happens is you send an email or you send an assessment, and the local authority must notify within 6 weeks of a request whether they think an assessment is necessary. That's when I talked about pressing the big button, that's they've got the 6 weeks. As part of this, they must obtain information from as many people as they can. So advice and information from the child and young person. From year 9, that advice and information needs to assist with preparation for adulthood, which are slightly different areas of the code of practice. Education support, medical support, any health cares that are involved, and also social care. Social care is quite often forgotten about, but it's really important that we remember it's an education, health and care plan, and it should be tripartite in terms of all of those people being involved in the formulation of the advice. And any young person that the parents have requested that they seek advice from. We'll probably talk a bit more about that in a minute, about therapists and NHS versus statutory private services.
Fab. Thanks,
Go for it.
Okay, so just to give you a little bit more detail then about the evidence that's needed to get an EHCP. Now this, Katie mentioned before about notional funding. So we often get families who are saying, it's really obvious that my child needs an EHCP, but there isn't an evidence trail behind that. And by evidence, I mean a paper-based trail or photographic evidence or video evidence of why the child is struggling in school and also what's being done about that. So there needs to be evidence of, first of all, their academic attainment and how that compares to what we call age-related expectations. Now, there is a bit of a theory in a lot of local authorities that a child has to be performing 2 years behind the level of their peers in order to qualify for an EHC assessment. That's not legal, but it's kind of just happened. And people now refer to that a lot. So in a mainstream school, there's a breadth of ability. Schools are comfortable with saying some kids are working at least a year below their peers, some children are working in advance of those peers. So they kind of look at that as a ballpark figure. Usually the child's working a couple of years behind. But of course, as Katie said, if a child's had a road traffic accident or something's happened that's changed their needs, we might have to have very rapid evidence of what's going on and what's different. So we need information about the nature, the extent and the context of the child's special educational needs. If it's a behavioural need, we need evidence about that. If it's a learning need, we need that kind of evidence. We also need evidence of the action that the school have already taken. What have they done about it? So it might be the school have done reading groups, maths intervention groups, they've put support outside at break times. Whatever that looks like, we need to capture that. Sometimes schools almost forget what they've already done because it's happening anyway. Oh, well, he goes to the phonics group. Oh, yes, he goes to the little social group on a lunchtime, but that might not be documented. So sometimes what we find is we're helping a school to take a step back and do an overview. What have you done so far? We also need to know that where's the evidence that progress has been made, because it might be that the intervention is working well. That's great. But we need it to continue. So school might say, well, we can't continue to run this group for a long time. We've done it for a while. We know it works, but we now need the EHCP to secure funding for ongoing support. So we want to be very clear about the child's needs, all of them. So their physical needs, their social and emotional needs, their health needs. So we also want information from other colleagues. So that might be therapists. It might be health professionals, including medics. So, for example, an epilepsy nurse might have a lot to bring in terms of evidence, or a paediatrician. Yeah. So we want to know what everybody's doing, what's working and what's not working. If the youngster is over 18, then the local authority needs to decide whether that young person needs extra time to do things to complete their education. So, for example, a lot of young people would leave education at 18. But it might be that we need to spend more time in education, again, that EHCP going up to the age of 25, in order to help them to achieve what their potential is. So this is where education and training is really vital, and we've got to capture that as well. In terms of the actual content of an EHCP, it's divided into key areas. So section A, the views and aspirations of the child and the family. B is their special educational needs, and that's basically usually in a lot of local authorities they'll do that as strength. They might do it as strengths and weaknesses, or they might do it as areas of strength and challenges, or they might just say that what's the weakness is a need. The language can vary, but it has to capture everything. What are their needs under the categories? of cognition, communication, physical, sensory, and their social and emotional needs. As they get older, then we need to add in preparation for adulthood. That needs to be there. The health needs should be in there in section C. Social care needs are in section D. The outcomes, that's a really important thing, and we're going to talk about that in some detail. The provision that's required, and the provision is what needs to be happening during a working day. What does that look like? And that can be about therapy or support or small groups or environment. Healthcare needs should also be documented, and the social care provision should be there. So we've got sections that describe need, and we've got sections that describe the provision. The final section of an Ehcp is the named placement. Okay, so will I hand back over to you, Katie?
If you can do.
I'll let you be in charge for a while.
Thanks. So in terms of a request for a specific school, parental preference now has a big part to play in naming a child in an Ehcp. I'm sure all of us work in the field and we all know that special schools are overwhelmed, everywhere is full, but a parent still has a right to name where they would like their child to go to school. Firstly, every parent has the right for the child to go to mainstream, unless they can really prove that mainstream is not suitable because the provision is inefficient for the education of others. For example, if a child was very violent and they could possibly hurt another child when they're at school, or it's insufficient in the use of resources. So for example, a child going to the mainstream school would cost a fortune and it wouldn't be reasonable to the public purse. In addition, if the child wanted to go to a special school, which was either not in the local area or was a non-maintained special school, that's when we tend to go to tribunal. We tend to go to tribunal over section I, which is placement. Now, a draft plan should not have a placement named. A placement should not be named until a final plan. The whole process is supposed to be, these are the child's needs. That's what we look at first. We then look at what provision they need to meet those needs. We then look at the outcomes that we can set to prove that provision is appropriate in meeting the needs that we have stated. The placement should only be thought of as an afterthought, really, after all of that has been sorted. So parents can request a particular school, they can request a non-maintained school. What normally happens is, as a head teacher, we would receive what we call consultations. So a consultation would go to a mainstream school, a special school, any school in the locality, part of the local authority's local offer, and any school a parent has requested. So a consultation would normally only go to an out-of-authority school if the parent had requested that it goes to that school. When that goes to that school, they consult with the head teacher to say, or the governors, can you meet the needs of this child? They say yes or no, feed that back to the local authority, and the local authority will name that school unless those two reasons. So it's not, the provision is inefficient with the education of others, or it's inefficient use of resources. Okay, AOTS. AOTS is something which is becoming more and more apparent alongside elective home education. So elective home education, I'm going off the slide, but never mind. Elective home education is something that comes to us quite regularly at the moment, particularly in light of COVID, where people are choosing to electively home educate their children rather than send them into school. If children were shielding or they had complex health needs, it's becoming a very common request. Elective home education is not something we print at as soon as it happens, because the second you ask for elective home education or state you are electively home educating your child, the local authority has no statutory duty to fulfill the education, health and care plan. None at all. They've literally said, we want to educate our child. They say, thank you very much, and off you go. Now, any child can be home educated unless you've got an Ehcp. When you have an Ehcp, the local authority have to agree that they feel that you can offer your child appropriate provision at home. I don't think we've ever had a state of play where anyone's refused it.
No, nobody's ever refused it. But what we do find is that we try to work in partnership with families to advise them as to how best to do home education. So we don't just say, off you go, crack on, see what happens. What we do is we say to parents, let's have a very clear rationale as to why you're doing that. How are you going to do it? A lot of us will work with families where there's obviously a legal case around them and where there's perhaps a pot of money. So we would help the case manager and the team to look at what the package would look like to document that. And what we always recommend to families is, if you're going to home educate, share the package with the local authority. So send them back copies of things, send them your rationale, your timetable, your activity plans, and also a record of progress. For a child who is home educated, where it's elective home education and they have an EHCP in place, the local authority have a duty to monitor progress by still doing an annual review.
And keeping the EHCP live.
So although they don't have a duty to provide any money for the delivery of the package, they do have a duty to monitor that progress is being made and that the child is safeguarded.
And if they don't believe they are, they can pull them back into school at any point. So go back to the right slide, which is AOTS. So AOTS, which is education other than at school. Education other than at school is only normally agreed on a short-term basis. So if a child is rehabbing after an accident, or that they can't find an alternative provision in a local authority school or in a maintained school. The local authority have a duty to provide an education. If they can provide that education, they have no duty to fund an AOTS package. When it's an AOTS package, sometimes, normally, it's left blank and it either says a specialist provision or a mainstream provision. But what we are finding recently is that some local authorities are actually naming AOTS in section I. It's not something that's legal, but we are finding that in terms of the current practice that people are more willing to put AOTS into the section I. So, sorry,
there we go. So we're kind of moving on now to think about some practical sort of advice for colleagues, and then we're going to talk in a lot more detail about outcomes as well.
Okay, do you want to do this one?
Yeah, okay. So just thinking about really then, if you're making a request, we're still thinking about EHCPs, gathering your evidence, that kind of thing. Just one important thing to say is about private therapists or private advice. And so what happens is local authorities will be very keen to focus mainly on the NHS therapists who are involved in their area, and also to look at statutory services. And this can be a point of conflict. So we're probably going to get questions about this, and we're anticipating questions about this. So we're going to touch on it, and then we're going to talk about outcomes and evidence for the next few slides. So if colleagues are going through the process of an EHCP application and families are seeking expert advice, what's really important then is to make sure that the recommendations that those therapists make are very specific, and to start thinking instantly about the EHCP document. So writing a report is great, and we can all write really good reports that are very, very thorough. What we want to do is make that report very, very accessible to colleagues in the local authority who might be trying to lift information from it in order to put that into an EHCP. Now, in some local authorities, the caseworkers who write EHCPs, who do the drafting of the document, they might be former teachers, or they might be people who've worked in a classroom. In other settings, though, they might not be. They might be administrators and secretaries. So they might not always have a really good working knowledge of the documentation or the jargon that's in a report. So we just want to make sure that when you're thinking about writing a report, first of all, you think about those recommendations you're making and the wording you are hoping they are going to cut and paste into the EHCP. Make sure that the recommendations as well are quantified and very specific and detailed. And we're going to talk about this a lot. You can't write random things about this child needs speech and language therapy. It's got to be the reasons for that, what the child's needs are, and how much is going to be required in order to make the difference. And so also, if a therapist is writing as well advice about what they need to do with the child, to put in the time as well for review meetings and multidisciplinary meetings. So to quantify basically everything that's really important. The local authorities, as I said, they're going to prefer to use statutory reports. Okay, they want to look at what the NHS are going to offer. And we are aware that obviously NHS colleagues have different demands on their time and different capacity. So we just want to make sure that we acknowledge that, you know, that is real life. So if the independent specialist is really going miles away from what the NHS therapist is saying, then we need to be clear as to why. So it might be that a therapist says that typically they would do a 6-week block of work with the child at the start of the academic year, and then they might train up some staff and review that 6 months down the line. An independent therapist might have the capacity and feel it's important for the child to have ongoing therapy every week. We need to be clear about why we're doing that. It's not to say that anyone's right or anyone's wrong, but we need to show that justification very, very clearly.
And it's being aware that those are the things which will go to tribunal. So quite often, if it's agreeing how much therapy is in a plan or is not, that would be a point that would be argued in a tribunal. So it's being really clear what your justification is.
So what we're saying is, we need to be very clear then about specifying and quantifying, okay? So the first point is that in section F, you've got to specify and quantify hours, staff, expertise, so we know who's going to deliver something and how long for. We need to avoid vocabulary such as words like the ones that are listed on the slide: regular, appropriate, access to, small group. That's not specific enough. We need to be very specific. If it's regular, what do we mean? Once a week, once a day, once an hour? What does that look like? Professional. Teaching assistants would consider themselves to be professionals within a school, but do we mean a teacher? Do we mean a teaching assistant? Do we mean a therapist? Do we mean a therapy assistant? We need to be very clear about what that is. And small group. Well, what's a small group? Is it 2 children, 4 children, 6 children, 8 children? A small group might be 8 children in some settings. A small group might be 4 children in another. So we need to be clear about that. And also what we need to be aware of is colleagues within the local authority will not always quantify. So they will say the word small group, and then somebody like me or Katie will say, well, what do you mean by that? So we'll nitpick. So it's really good advice for you to try and nitpick before you even start. Be very specific about what you're recommending.
What I would also say is that if you can talk to the MDT, I've once been at a tribunal where counting up the hours that were recommended by therapists, all very justified, who hadn't talked to each other, there was 25 hours of therapy and no time for education. So it's really making sure that you're talking to each other so it's realistic, in light of the fact that it's a school.
So what we're going to do now is just summarise, therefore, the annual review process before we move on to talking about outcomes.
Okay, so the annual review process. The annual review is a process. You are reviewing an Ehcp document. It is not the actual meeting. So first, what happens is at least 2 weeks before the meeting, everyone should be invited to the annual review. That's the school's responsibility. So it's the head teacher and the school's responsibility to invite everyone to the annual review meeting. It's not sufficient to get information a week before. Normally schools plan it sort of a year in advance so they know when they're coming. The next part is for the school to obtain advice from all invitees. That should be at least 2 weeks before the meeting as well. Then they actually hold the meeting. At the meeting, they need to consider the child's progress towards the outcomes. That's what we're doing. Let's start again. We're reviewing the plan. So we're reviewing the outcomes to see how far the child has come, whether they're still appropriate, and whether we need to set new ones. Consider what provision is required to assist in adulthood. This is if the child is in year 9 or above. From year 9, they ask us to consider the areas of preparation for adulthood, which are good health, education and training, community and friendships, and the one I always forget. There's a fourth one. After the meeting, within 2 weeks of the meeting, the school or whoever chaired the meeting should prepare and circulate a report of the meeting to everyone who attended. So after everyone attended, it should really include what was discussed at the meeting, particularly any disagreements where there was differences of opinion, and the plans for amendments to the Ehcp. This part, when you're at the meeting and you discuss changes, you are making recommendations. You're making recommendations. So anything that's discussed and proposed is not agreed at the meeting. It then has to be agreed by the local authority. So quite often we hear people say we discussed it at the annual review. Why is it not in the Ehcp? We're just putting forward proposals there. They don't have to make those amendments. Within 4 weeks of the date of the meeting, the local authority need to decide whether they are going to maintain, amend or cease the plan. And they should let everyone know, no, we don't intend to make any changes. Here is the plan. Yes, we do intend to make some changes. Then they've got time to do it. This part has no time scale. So there is no, you must then get the draft within so many days or so many weeks. There's no time scale to this part. Once you get a draft plan, there's 15 days to send it back to the local authority. That can start the process again. So if there's been lots of changes to the draft after 15 days, you can then get another draft. So this process can repeat itself, if you like. Still, ideally, from the moment the invitation to the annual review to the final draft, the final plan being issued should still be around the 20-week mark. Okay, so it's similar to the original plan for getting an EHC assessment. It doesn't always happen that way.
And the problem that we find is quite often plans will come back and they might have highlighted language, or they might have bits in red or bits in green, or whatever the local authority have decided is their process. They might not necessarily redraft and reissue the plan. You might get a plan back that's got lots of bits crossed out or lots of bits highlighted, and it's kind of like you just need to live with that. That's what the local authority would say, that's what we do. That isn't acceptable, that's not legal, but it's common. So quite often you can be looking at a document that has lots and lots and lots of bits that have been changed but never been deleted and removed. So you might be talking about a youngster who was 3 and they were potty training, and they're now actually 14, and it's just been highlighted and left, but it's still there. Yeah. So a lot of these documents we know are very, very poor, and that can cause a lot of problems.
And it's really important. The key parts that are really important is if a child is moving to another provision. As I said before, when a school is consulted for a placement for a child, they get the Ehcp, that's the document they have. So it's so important that that is accurate, up to date, and really highlights what the child's needs are, because certainly when I was ahead, there'd be certain key phrases and words that I'd look for, and straight away it would be no, not suitable. That wasn't always the case, but the quality of the paperwork was so poor.
Okay. So outcomes. Now this is the big bit. This is why we got lots of questions. Okay, so we need to talk about the outcomes that are needed. And so first of all, the outcomes that come out of a meeting or a discussion. Well, outcomes should be produced with a collaborative approach with the child, their family, and everybody who's working on it. Outcomes should not be written by the SENC or the teacher on their own. Sometimes you might go to a meeting and the teacher might have done a bit of drafting to have a think about the outcomes in advance. That's okay, because they've done a bit of thinking, a bit of preparation, but it has to be done. Everybody has to agree the outcomes. The outcomes need to clearly state what the benefit is for the child or the young person. So a good example of an outcome is for my friends to be able to understand me so that I can join in with their games at playtime, or to be able to buy my ticket and travel on the bus by myself. An outcome such as to improve the intelligibility when speaking, that's not a good outcome, because the child is not at the heart of that.
Nor can you ask them, have you improved your intelligibility when speaking? By what measure? It's really hard.
Yeah. Outcomes need to be expressed from the child or the young person's perspective. Yeah. So what will the child be able to do? And that's a good phrase. You know, the child will be able to. That's a good way to start. So Emily will get dressed by herself by 8 a.m. so she can catch the bus at 8:30 a.m. with her friends. So Emily's at the heart of that. It's not an outcome to say that you're going to provide Emily with a mobile phone in order to support her independent morning life skills. Yeah, that's not an outcome. So we're going to really start to look at outcomes now in a lot more detail with you.
I think what's always really helpful is to think about what do you want the child to be able to do by the end of the timescale of the plan that they can't do now. We have to make sure that outcomes are manageable. Sometimes you pick up plans which have got 25 and 30 outcomes. That's not manageable. It needs to be something that the child is working on all of the time, that everyone involved with the child knows what they are, and the child knows what they are as well. Needs have to come first. So the child has a need in a particular area. From that need, they need a provision. From that provision, they need an outcome. You can't have an outcome that hasn't got a need. So every need has to have an outcome, and every outcome has to have a need.
Yes.
Outcomes have to be important to the child or the young person. So Cyril will move around the school building independently, ready for his transition to secondary school, rather than to improve my independence. To improve my independence to a child who is 11 is just huge. We need to have something that's measurable, understandable, and it's their plan, it's their outcomes. They need to know what they are working on and be able to do it. So if it's not measurable, we've got no way of judging if it can be achieved. We do not know what being independent looks like or feels to the young person, or why that's important to them. There's nothing worse than sitting in an annual review and trying to review outcomes that nobody understood what they meant in the first place. So it needs to be specific to that child or young person. Whilst we all have banks of outcomes in our heads that we use, it's got to be relevant to that child and important to them. It has to be personalised. It has to be measured. We have to be able to measure it, because how do we know that it's complete? How does the child know that it's complete? And what difference did it make? What difference did it make to that child? How did the provision that we provided as practitioners, that the local authority paid for, how did that make a difference to that child or young person, and how do we know? Also, is it realistic and is it achievable within the timescale? Sometimes they are so broad, like to develop fine and gross motor skills. That's a favourite target that lots of people like to have, or to access a broad and balanced curriculum. Nobody knows what it means, so we can't say that we've achieved it or not. Have you identified an appropriate timescale? Sometimes we have aspirations, and aspirations are much bigger. We don't have to timescale those, but if we're looking at outcomes, we really need to have a clear timescale involved. So these are some good outcomes and some bad outcomes. So at the top, by the end of Key Stage 1, Shane will be able to read and understand simple stories from Year 1 texts with fluency, so that he can share books at home with his brother. So simple stories could have meant anything to anybody. So we've quantified it by saying from Year 1 texts, because in schools they should know what a Year 1 text is. With fluency, so he can share books at home with his little brother. That's about him. That's about him feeling that he has done something and achieved, and he knows that he can do something functional, rather than just to improve reading skills. Improve reading skills from what? If we have no start point or end point, we don't know how we've made any improvement. I will have passed my second proficiency test by the time I go to secondary school, so that I will be able to ride my bike safely on the road. Again, a really clear target for the child. Yes, we know that from a physio perspective, we may have been working on trunk control, we may have been working on reciprocal cycling. We know that we're doing all these things, but we're making it so that it's realistic for the child that they are doing something. They're riding their bike. We know that we want them to learn those skills to ride their bike. To them, what matters is the riding of the bike. It's that so what part that really is important. So by the end of Key Stage 3, Annalise will be able to enter an unfamiliar shop and buy a chosen item and walk to familiar shops for small errands on a daily basis. We and ahh'd about this one because it's got two parts about it. So we've got chosen the item and walking to the familiar shops. So sometimes you could say she's achieved one part but not the other. So we try to have one clear thing that we can say that it's achieved, rather than it being split into component parts. By the end of my course, I'll be able to get to an interview independently using public transport, something that is really measurable and functional. There may be loads of things that they had to learn to do to get to the interview independently. They're the short-term targets, but that long-term target is something that's really clear and functional, and the child knows that they've achieved. These ones are not so good. So improve well-being and fitness. How do we know we've achieved it? What does that look like? As I said, develop fine and gross motor coordination. Achieve 2 levels of progress by the end of Key Stage. Progress in what? 2 levels of what? What are we talking about? It's not specific. We have no idea whether that's been achieved. Carly will have a teaching assistant to help her manage in class for all practical subjects. That's provision. Okay, so that's a provision that we're providing to enable her needs to be met. That's not something she is achieving. Access to a broad and balanced curriculum. We'd like every child to have access to a broad and balanced curriculum. Outcomes shouldn't be something that is a standard that everyone should have. It should be something that's really specific to the child.
And what we know is all of the examples we shared with you are real. So these are not ones we've made up. We see these all the time. Okay, so what do we think about then when we think about our roles as independent professionals? And Katie and I have obviously been head teachers. We ran schools where we directly employed all of the therapists, as well as teachers and teaching assistants and psychologists. So we really value multidisciplinary working, and we've had that privilege of working not just as head teachers, but also as classroom teachers. So we worked alongside colleagues, and we know the value of that. But what we have to remember, we think, is we're guests in a school. And so we often work with teams where people are finding it tricky to get into school, and maybe to negotiate with them. So we start off with really some little bit of advice really about, we want you to appreciate and understand the demands that schools have. So our aim is always to establish collaborative practice. We are part of the team, and the school and the child are at the heart of that. We need to be very child-centered, and to make sure that we're thinking all the time about how is this going to impact on that young person. We need to be realistic about what we want to achieve. And there are some things we know it would be amazing if we could do a certain thing every day for an hour. It's not always practical to do that thing every day for an hour because we've got a curriculum to deliver as well. So we need to remember that the school has a statutory duty to fulfill a curriculum. We can negotiate with them, we can try to reduce subjects, we can think about different ways to work, but ultimately they have to deliver an education and they are bound by statutory guidance. So we're guests in the school. And the way we always see it is we're invited to go in and work collaboratively, but our input should be positive and supportive, and it shouldn't be seen as a challenge. We want, though, to help you to think about that a little bit more with the difference between primary and secondary schools, because quite often you can have a really good integrated package established in a primary school, and then the wheel falls off when we get to secondary school. So just to think about that. So obviously, in terms of managing visitors, guests, therapeutic interventions in a primary school, it's a lot easier because you're dealing with one teacher or maybe two if it's a job share. Secondary school, you could have up to 20 teachers dealing with a child. And Katie and I talked about this yesterday because I was saying about 12. But then when you look at sometimes where there are job shares, or you might, for example, have 3 science specialists. So one does the biology, one does the chemistry, one does the physics. The number can actually go up to 20 different teachers working with a youngster who's in a mainstream setting. In primary school, you've got one room. Secondary school, you're moving around from class to class. So again, in primary school, you can have lots of kit and stuff all set up. You know, it could be a standing frame, it could be a specialist chair. That's really easy. You're just juggling with the classroom in a small space. That's not always possible to deliver in a secondary school. And we hear that a lot where schools are saying, well, we still really need him to be in his standing frame. Yeah, well, where are we going to put it? Because, you know, it fits really well in the art room, but he's only in there once a week. So that kind of juggling and those practicalities can be difficult. For the child, in primary school, there's one peer group. They're in the class. In secondary school, they could be moving to different ability groups. They might be in a small group for English and a different set for maths. They might be within the nurture group for English and maths. They might be in the mainstream body of the school for art. So it really delivers different opportunities, but that can mean it's quite difficult, for example, to deliver a social skills program, because when are you going to do it and with which peer group? In a primary school, typically the teacher and the leadership team will know the child really well. Secondary school, that student is one of hundreds and sometimes thousands of young people. So we work with a school in Nottingham that is the biggest school in Europe, 2,500 young people. And we're going in talking about one or two kids. And yet, I mean, to be fair to that school, they do know that youngster very well, but we need to remember that the maths teacher might not know that youngster very well, but the SENCO might.
And also the physical size of the school to fit nearly 3,000 pupils in is huge. So if you're moving a chair from one side to another or a standing frame from one side of another, it can take you about 25 minutes.
Yeah. And there are ways to be flexible, but it's hard. So in terms of a primary school day, it's dead easy to be flexible. You know, the teacher could say, oh, you've missed that this morning, but we'll finish it off this afternoon, because they can just direct the TA, they can juggle their time. In a secondary school, that is much harder. The individual teachers don't have control over the time. There might be catch-up opportunities built into the timetable, and we need to think about that, but it's just not as easy. So basically, in primary schools, there's much greater flexibility of approach. It's much more difficult in secondary. And also secondary schools might have other rules that they need to follow, for example, sanctions or detentions. For some of the youngsters I work with an acquired brain injury where behaviour is a problem, putting them in detention is utterly pointless, in my opinion, but the school have no option. They have to be seen to be being fair to all of the young people. So not everything can work. Okay, so what we wanted to kind of validate there with you as guests in schools, what we want you to think about therefore is the issues that all of schools will have to face. Pressure on teachers. You know, even if it's a primary school teacher, they've still got 30 children to deal with, and we've got a visitor coming in who would like to do a session with a child. They'd also perhaps like to give the teacher or the TA a bit of feedback. That teacher might be going on duty at lunchtime, so they haven't got time then. So juggling time and juggling their workload is colossal. Most schools will say they've got very limited resources. That's been made worse by COVID. So time and space are the two biggest resources. Schools don't always have a spare room. They don't always have a space for you to work in. And so we need to respect that and work around it. But also time, as I said, is absolutely precious. You know, teachers are often leaving the classroom at 3 o'clock to rush to their departmental meeting. You know, so it's hard to fit us in. Ofsted, need say no more. Ofsted is a pressure, and schools worry about that. And as a former Ofsted inspector, you know, I've seen it from both sides. But that is something schools are worried about. If we don't do something, what will Ofsted think about that? And how do we justify the things that we do? So we've got curriculum pressure, and then we've got the statutory side of things. You know, I was in a meeting last week with a mum who said, why doesn't he just drop RE and that'll give him more time? School said, because we have to deliver RE. It's a statutory requirement. Mum's saying, well, he's really bored in RE. That's not the point. We've still got to deliver it.
It's also, I think, the balance of quite often we have children with physical disabilities, so we ask them to leave 5 minutes early. We're asking them to leave 5 minutes early every lesson all of the time, and we always have the pressure of then how do they make that up? How does the teacher then has a pressure of making sure they finish the lesson sort of 5 minutes before, and we ask them then, can you make sure you said the homework 10 minutes before rather than 5 minutes before, so they get it. So we're asking them quite often to juggle more plates than they're already juggling. So it's just being aware of the other issues.
So what we know is that the child that we are working with is one of many. And so we need to be thinking about that all the time. The final thing to mention is about training. We talk to teachers a lot about training, and they will say that someone wants to come in and deliver some training. But what they will tell us is that training has to be at the right time for them. Ideally, not longer than 45 minutes, because they'll do it in a staff meeting at 3 o'clock. So they'll say to me, Judith, can you do training 3 till 4? But then I know that they won't get from their classrooms till 3:15, because they'll go to the loo, they'll get a cup of coffee, they'll see the kids out the door, then they'll come. So I immediately know the training's not going to be an hour. But they will also say to me, it has to be practical. We want good tips. We don't need theory. We don't need to know about the diagram of the brain, even though I'd love to discuss it. They want to know what to do with that child in an English lesson or a maths lesson or in a PE lesson. So it needs to be really practical.
And sometimes we have to repeat it because they can't listen. So quite often, if you're giving them even if it's the right information at the wrong time, they've got so much on, they just can't take it on board.
So that's what we wanted to cover today. And we've covered all the things that our colleagues at AT Therapy asked us to. So I'm hoping that Ellie's going to take back over now, and we've got the opportunity to answer any questions if any have been asked.
Yeah, thank you so much for that. That was really useful and interesting. We do actually have quite a few questions for you. So I've just been making a note of them. So the first question is from Abigail, and she's asked, what happens if everyone has decided that specialist setting is best for the child who already has an EHCP, and the preferred school has agreed that they are best placed for that child, but the local authority have refused to change name setting, so mainstream to specialist for child, despite this child already working at FS level when in year 5?
You've been reading my case notes. And I think that this is something that we're coming across far too frequently. What we can do is very little at the moment. I think for me, it's about understanding the reasons as to why that the local authority has suggested that they won't name the special school. Is it because they are full, which is quite often the case? What we have to do then is look for an alternative. So if that special school has been identified and they are saying there's a waiting list or it's full, the local authority still has a statutory duty to provide the right education for that child. It's really a waiting game, looking at alternative provisions game. And if there is still nothing available, it's going to the local authority again and pushing them, but you have to get everyone on board. The school would have to say, we can no longer meet need. Yeah. And if they say we can no longer meet need, and it gets to a point where the child can't go into school, that will force the local authority's hand.
The key thing there is your evidence. So it's not just the opinion of the people involved. You might all go, he definitely needs to go to that school, but where's your evidence? Where's your evidence of what is wrong with the other provision? Yeah. But like Katie says, the most powerful tool is if a school who love a child and they want to do their very best, they have to put their head above the parapet and say, we can no longer meet need. We can't do it. And therefore that forces the local authority to make a different choice.
Yeah, it is very much a case of that everywhere's full, that everyone's got the the same challenges.
Next question, Ellie.
Perfect. So Lisa's asked, what sort of evidence is needed for preschool children transitioning into primary school?
Preschool as in nursery age going into primary age.
Like before they're at school.
So obviously you've got standard guidance like the EYFS, the early years foundation stage, the journals and things like that. So all that evidence is really valuable. What we recommend is really asking people to do things like witness statements, but not like a legal witness statement, where you're making a document in a classroom where you've done an observation, where you've got photographic evidence, where you've got video evidence. And I think as well, photographs of a child's work where you've annotated on that and the difficulties that were presented. So say, for example, it's a child with significant fine motor difficulties and they're really at a very early developmental stage for mark making, showing a quick photograph of they're still using really chunky crayons, that you can see their hands, you can see their grip, and then you can make some notes about what you've tried. We're still not able to use a pencil, but we've introduced it. So you're basically showing what you're doing, what you're trying, and what's not working, or what is working. But you can, like I say, photos, videos, descriptions, also keeping a running record. So having a chronology of what's going on. So say a child is struggling with numbers to 10 and they're still struggling with numbers to 10, even though you've done daily practice, you've done lots of games, you've done lots of counting of objects, you've been outside and counted like big steps and all those things that you're doing. Actually write that down. These are all the things we've done and we've still got a problem. So you're showing your evidence of what you've tried and why you're still seeking that further input. And also that means then that when they're moving into the primary school have got a really good baseline of information and they're not trying to start afresh.
Yeah, it would also include anything like medical letters, any health visitor reports, anything like that as well, if it's a child who's not in any setting at all.
Perfect, thank you. And then Chrisana's asking, she's got two kind of questions. So if support is listed in an EHCP but not provided, how can we go about getting this?
It's about appeal.
Yeah, so hold on. So it's in provision, but the child isn't actually getting it.
Yeah, so the support is listed in the EHCP, but it's not being provided.
So I would think that what it would be if it's not being provided at all and it's having an impact, it's calling an intramanual review and using it. The EHCP is not a magical wand. So quite often people think that once the EHCP is there, bang, all of these things will appear. Unfortunately, they should do, and it's the stick to beat the local authority with, but it doesn't always happen. So it's about parental complaining, anyone else involved calling an intramanual review and saying these things aren't happening. And trying to force their hands that way, but there is no magical. Where they have a difficulty at the moment is if it's not available.
Yeah.
Oh, sorry. I was going to say the other part of that question is that I have a client that has been through an appeal via public law team and still is not getting the support listed within it. So how can we move forward?
Yeah, if you've gone that far, you're going to have to go down a formal complaint route. But what I would say is sometimes a legal appeal isn't the right way to go, because what you actually want to do is stop and work in partnership with the school. So I think sitting down in a meeting and saying to whoever's in that meeting, this is what it says. It says Billy needs one-to-one support, but he's not getting one-to-one support. Can we talk about what that looks like and why? And really getting to the bottom of it, because sometimes it's about perception. Is the child getting what they need? And the school might say, do you know what? Billy does get one-to-one, it's just he's in a group of 3 and we try not to make that person sit next to him all the time and we want to explore it. Yeah, so sometimes it's about how we define and how we describe the provision that we're saying we haven't got. But sometimes it is like they're just not getting it. So, it says he should get speech therapy and there's been no speech therapy in from the NHS for months and months and months. That you do have a right to complain then, absolutely you do. But I would still go back to talking to the school and saying, how can we put this right together? What can we do? And
it's understanding whether it's can't or won't.
Yeah.
Because, and obviously there was what they did over COVID, where not all of the EHCs had to be delivered as it said, because obviously they couldn't. You can't deliver hydrotherapy every week if every single hydrotherapy pool is closed, so that type of thing. But it's definitely understanding, having a conversation. Are you not delivering this because you don't believe they need it anymore? If not, we need to have a conversation about that. Or are you delivering it because you physically haven't got the provision? If not, we need to have a conversation about that, because otherwise if you have a really clear understanding of the why beforehand, then you know which way to push it forward.
And remember as well, if you put in a formal complaint, then you're going through a process where it goes to the governing board, and that, you know, you can talk to people at a higher level. It's not just the buck stops with the head or the deputy head. So take it as far as you can. What I would say is that always keep your chronology. I sent a letter on this day, but start every time you can, try face-to-face. That's always my advice, try face-to-face.
Mm-hmm. Thank you. Yeah, we've still got a few questions left, so I'm going to try and get through as many as possible. So Kat's asked, despite not having a duty to provide money or funding, do they usually? So I think this was relating to the slide about home education and the local authority.
Absolutely not.
Okay.
No, if there's no duty to provide it, then they basically won't. With EOTAS, you can negotiate. I have got one child who's home educated in Nottingham, and the NHS honoured the therapy for 2 years. Mm-hmm. That was very, very unusual. And so if they don't have to do it, why are they going to put their hands in the pocket? No.
Okay. Yeah. And then her second question is, does it always have to go to tribunal if parents want an out of a county school? Is there anything the team can do to help with this assessment stage?
Yeah. So in terms of the schools that Katie and I run, we're on the non-maintained sector. I ran my school for 11 years. And in 11 years, I had 2 tribunals.
I had a lot more.
She had a lot more. She's not as good as me. But what I would say is...
Well, my school was oversubscribed.
Anyway, right. In terms of does it have to go to tribunal, if your evidence is good, if you are demonstrating that you are fair, reasonable, that the reason you're ruling out certain schools is very valid, and it's not just about parental choice, but it's also about having a good rationale. Why can one school, in your opinion, not meet a child's needs and the other one can? So really taking your time, demonstrating transparency with the local authority. We've visited all these schools, we've looked at them, we've done tasters if that's possible. So having a very good evidence trail. The reason for tribunal is really because you've kind of reached an impasse. But again, it's about talking to people and trying to demonstrate that you're being fair and reasonable.
And also don't stop once the appeal has been lodged. Quite often we will get a date for a tribunal, or we'll get the bundle, or any of those things, but then it doesn't go that far because we're still working in the background, mediating. It doesn't have to be a formal mediation. Well, you do have to get to the tribunal stage, but mediating to look at alternatives all the time, because fundamentally, no one in the local authority wants to do anything other than a very good job. I know it's sometimes hard to believe. And fundamentally, they work with children for children, and they want them to be in the right provision. So quite often, if you can sort of find that common ground and really work with them and understand where they're coming from, normally you can find some resolution without the tribunal actual hearing.
Try very hard to pick up the phone to somebody in the local authority and say, we're really in a tricky position now. We'd like to come and have a conversation with you. What can we do? And with the best will in the world, you know, sometimes you will end up in tribunal because you're just not going to agree. But I think that we find that if we talk to people, we can normally, touch wood, resolve the issue before it gets that far.
Mm-hmm. Yeah. And then kind of the last question, it's kind of split into 2. So Laura's asked, what happens if the NHS and independent therapists have opposing recommendations?
Well, they always do.
Yeah. Well, first, like we said, you've tried to meet a common ground. So I, for example, once had a child who was recommended 3 hours a week of hydrotherapy. Well, we just turned around and said, well, there's no way I can't give you that. Do you know what I mean? So again, talk to each other, sort of try and understand where the common ground is and why you totally disagree. Now, sometimes the NHS therapists I had one lot in one local authority, we can't say that, we have to say this. So they were quite bound by what they felt was their directions from on high, which is where the conflict came from. But it's talking to them. It's always trying to have those conversations. If you get to the situation where you totally disagree, the local authority totally disagree, and they name the NHS provision in the plan, that's when you would look to go to tribunal, if it was worth it. Because it's really looking at going to tribunal. Is it? Yeah.
What we need to remember is, I'm guessing that some of a lot of the people on this seminar might work in the private sector where there perhaps is a pot of money because there's a legal case around a child. So there's a very important thing about you get what the child is entitled to from the NHS, and that is absolutely fair and absolutely right. But then the NHS is bound by its own funding restrictions.
It's a limited pot.
And so therefore, what I will say sometimes is, let's get what we can from the NHS and then agree to privately top up the situation. And that's okay, yeah. So for many clients that can work. Of course, for some it doesn't, because they haven't got a legal case and they haven't got extra funds available. And that's when you really have to be sitting down and justifying. But you know, we all will have professional difference of opinion. And that's important to acknowledge, but the NHS therapists might be bound by budget. And so I go back to the example I used earlier on, that they might say, I can only offer a 6-week block of therapy with an understanding that then I will revisit in 6 months, and the school will be expected to pick up the therapeutic program that I have trained them in. That isn't unreasonable. It's about saying, well, how much of that works and what else can we do, and where can we, you know, maybe skill somebody else up? Can we have a bit more monitoring? What can we do? But yes, sometimes you will have to appeal if there's no other grounds. But you must be able to demonstrate very transparently what the child needs, not just what, it's not just about your professional opinion. Yeah. So you can't just say this child absolutely requires X amount of therapy, if really in blue sky world, that would be amazing. But actually what would be sufficient or adequate, yeah, to keep is what the NHS are saying. So that's really tricky.
Yeah. I often argue that I need a week in the Maldives every month, but like, it's sort of never quite. It's on.
I'm just aware that. Oh, sorry.
You could also do it for a year and then prove that it made a difference. So there is the possibility where you say, we will top this up for a year, and then we have got the evidence that actually, so when the next annual review comes around, you've got more evidence to say, no, this is a need.
Yeah. Yeah. And then related to that one, Cassie has asked, following on from Laura's question, what if the NHS and independent therapists agree on what the child needs, but the NHS therapist won't define one-to-one daily or weekly in their report? So local authority refuse one-to-one in the Ehcp. Is appeal and tribunal and the only option?
If they agree, but they won't specify because they've been told they're not allowed to write it down, I'm guessing they're not allowed to do that. I would sit in a meeting and argue. I would argue that out in a meeting, and I would say that needs to be minuted in the annual review meeting. So because remember, somebody writes minutes of an annual review meeting.
And what they have to say is where there was disagreement.
Yeah.
That's what has to be noted.
Yeah. So it can therefore be agreed in the meeting. This is what we talked about. That can be written down by like the person who's chairing the meeting can write it down and say that. I would dispute that.
Yeah.
Okay. Yeah, we've just had 2 last-minute questions. It's clearly been a very, very good webinar. So I'll just quickly go through these because I'm aware it's just gone past 1. So if anyone does have any burning questions, we've got the info@ahcp.co.uk email address on that slide. So if you want to ask anything, feel free to email and we'll get back to you. So the last 2 questions are: can a personal budget then be asked if NHS cannot deliver?
Can a person, if the NHS, so if it's an agreed need but they haven't got like an OT available, yes, you can ask for a personal budget then.
Yeah, but not if they disagree that they don't need
but not if they don't disagree the need.
Okay.
So you can ask for a personal budget is because you're saying,
yes,
I want an alternative way of providing what you agree my child needs. So you might say, I don't like the NHS therapist, I know somebody down the road who's much nicer, can I have a personal budget to pay that person instead? What you have to remember is the personal budget will never be as much as the amount of money allocated to the NHS person. But yes, you can ask for a personal budget as an alternative.
Okay. Yeah, and then the last one, just having a look at it, I don't know if it is a question. As a professional, we're supposed to say what we have assessed the young person needs, regardless of the service we are working in. This is hugely stressful because we know we are unlikely to be able to provide the input that our professional opinions suggest. So it's more of a comment.
Yeah, and that's a very, very common, valid comment, and it really needs to be acknowledged, because there almost is this perception that people in the NHS or in statutory services are dumbing down need, and they're absolutely not. They're working within restrictions, and that's why we're saying it's about collaboration and listening and valuing what they believe. But it is really tricky because, you know, in a perfect world, you know, we do all want to get everything a child needs.
But there's a lot of argument where people will say, we can't put that in a plan because we haven't got it in the local authority. Then there's been a lot of case law that you can't do that. It has to be what the child needs. It can't be driven by your local offer. It has to be driven by what the child needs.
Yes.
And it's their responsibility to go out beyond their local offer to find it if it's a need.
Okay, yeah, thank you so much for that today. That was really, really useful. We've had some lovely comments as well as the questions. So Nikki said that it's a fantastic webinar today. Thank you so much for sharing your expertise, Judith and Katie. Really thought-provoking in terms of the wording of outcomes. It'll definitely be something that will be taken back to some of the teams in which I work. And yeah, just lots of people saying thank you so much. Really, really useful. So just before we end the webinar officially, just wanted to remind everyone that we do have our Ahcp Therapy YouTube channel. So this webinar and previous webinars can be found on our channel. We also have some social media pages as well, where you could get some freebies, some freebie information that we might upload onto those channels. And we have our Ahcp Therapy Facebook account, so we tend to let everybody know about the webinars on there. Keep your eyes peeled. The next upcoming event is the Play Included training delivered by Nikki, one of our specialist speech and language therapists. That's going to be in winter 2021, date to be confirmed. You can book that on our Eventbrite page if you're interested in that. And the next lunchtime webinar won't be until the new year now. I can't believe it, that should say 2022, in January 2022. So that's going to be around eating and drinking and dysphagia with complex needs. So that's going to be with another one of our fabulous speech therapists, Laura. Again, you can book onto that on the Eventbrite page. And yeah, I just hope that it's been really useful for everyone. I know that I found it really useful. And thank you everyone for attending. I'm going to stop recording now.